All right, here we go. Well, welcome everybody. My name is Dr. Jen Pulido, one of the audiologists here. Today we are going to talk about brain hearing. So this is a presentation that we like to do every couple of months. Um, it's a lot of great information for those of you that haven't learned about this information yet. It's a topic that's really important, and I will go ahead and start sharing my presentation. Share my screen. Okay. Okay, hopefully you guys can see this okay. So we are going to talk about brain hearing health and how that relates to our hearing. Okay, so let's talk a little bit about what exactly is brain hearing. So a lot of people always think that hearing happens in our ears, that our ears pick up the sound, and that's how we interpret what we're hearing. But we've learned now that hearing actually happens between your ears in the brain, and more precisely in the auditory processing centers in your brain. That's where the sound becomes meaning. So that's when your ears take that information that travels to the brain, and that's how we understand. That's how we understand every day. So when you listen to a conversation, your ears and your brain work together as a system, but it's your brain that does the heavy lifting. It's like a muscle. So your brain needs to be exercised to stay fit. And we're going to talk a little bit about that. So let's talk a little bit about hearing loss. So people with hearing loss can experience a 30% greater decline in thinking abilities. So it's been shown that even with a mild hearing loss, this already increases your chance of cognitive decline. As the severity of your hearing loss increases, so does your risk of cognitive change. So this is saying as the hearing loss gets worse, your brain has to just work harder to understand and interpret what it's hearing. So your brain is working overtime when there is a hearing loss. So in the long run, that can affect your cognition. Hello, everyone coming in. I'm going to continue. We already started, but I'm going to change my slide. So this is just a chart kind of outlining what I was talking about. So the greater the hearing loss, the risk of dementia increases as well. So people with a severe hearing loss have quite more risk of developing cognitive decline than someone with just mild hearing. So what can we do about that? So there's something called brain hearing technology that's available in our hearing devices right now. So what brain hearing technology? It's a new type of technology that focuses on feeding the brain optimal information so that your brain can understand better. So the more information that your ears and your brain receive, the easier it is for your brain to understand, and it doesn't have to work so hard to interpret what it's hearing. So getting this technology in the long run can help your brain and reduce that risk of cognitive decline. So I know most of you do wear hearing devices, but what if wearing hearing aids is not enough? So what that means is, what if you do have really good technology, but you still have trouble hearing. One of the most complaints that we get is that people still have trouble in background noise, or they can't understand speech very clearly, even with the hearing aids. So that means there could be another component going on. When we do a hearing evaluation, you know, when we put you in the booth, we check your ears, we have you listen to beeps, have you repeat words. What that test is doing is it's testing at the level of our ears. It's testing what our ears can pick up, but it's not really testing what our brains are doing, how our brains are processing what we're hearing. So if people are still having trouble, even with good hearing devices, there could be a problem in how the brain is processing that information. So at HearCare, I know you've been hearing a little bit about what we're trying to achieve now. We're trying to do a little bit more testing. So what we're trying to do is to test beyond the ears. Like I said, our ears pick up the sound, but our brains are really the ones understanding. So we're calling this new assessment called the functional hearing assessment. It's a little bit longer. It includes the testing that we already did with the beeps and all of that, but it's a little bit more involved. We do have a little computer screener where we test your memory, we test your processing, things like that, and it tests those areas of the brain that are important for hearing. We add that to the evaluation, and we also do more speech and noise testing. So we have you repeat more sentences and noise with and without hearing aids, and it gives us an idea of how your brain is processing that information. Based on the results of that assessment, we kind of make a new game plan of what else we can do to help you. Sometimes maybe another set of hearing devices with better technology may help, but there's also other things we can do, and that's called auditory training. And I'll talk a little bit more about that. So a little bit more about the functional hearing assessment. So this test digs deeper into how you hear with and without your hearing devices. It can give us an idea about what additional support that we can provide in addition to the hearing aids. Like I said, sometimes you may do better with different hearing aids, or we can even just create maybe custom programs, or it can give us an idea of what we need to change or what we need to tweak with the programming. Sometimes even adding a hearing aid accessory may help as well. So this assessment kind of gives us a clue as to what else we can do to better help you. We can also do this measurement before we make any changes, and then 6 months later after we've done some changes, and to see if those results from this functional hearing assessment has improved. So kind of like a pre and post treatment. So in addition to making changes to the hearing aids, if we notice that there is some problems with how your brain is processing information, maybe there's some weaknesses there, which goes on as we age. There's also something called auditory training. So again, this is in addition to the hearing devices. So what auditory training is, they are exercises. They are designed to retrain your brain to process information better. This results in overall improved speech understanding, especially in noisy listening environments, which is the #1 area that most people have trouble with. So I'm going to talk about one type of exercise, but there's all sorts of different brain exercises that you can choose from. There are a lot of apps out there that you can download on your phone. There's a lot of websites you can do that have like brain exercises. But this one I'm going to talk about in particular is very good. It's called Brain HQ. So Brain HQ was developed by neurologists. So there's different categories of games or exercises that focus on different parameters. So I mentioned that screening test that we do that tests like your memory and things like that. If that shows that there's a weakness in your memory or your speed of processing, there's different exercises you can do to focus on that. So it's kind of really tailored to whatever your weaknesses are. And they're fun, they're quick, they're not boring exercises. But just like any exercise, like when you go to the gym and things like that, it does have to be done regularly. Otherwise, the brain cannot retrain itself to understand better. So we recommend, if you are going to sign up for this, to do at least 20 or 30 minutes a day for at least a month or so, to really train your brain to hear better. The brain is very neuroplastic, so it can rewire itself, make new connections to strengthen that brain wherever those weaknesses are. So you can sign up for this on your own. I believe it's a monthly cost, or you can pay for the year. Or you can sign up through us. I think we can set it up for you as well if you want us to kind of take care of it. So this is just one of the programs. There's also, there's workbooks that we can talk about if people don't like doing things online that help strengthen your brain. One of the easiest things you can do is to actually read out loud to yourself and put a little background noise in the background, like turn a TV on or music, and just read out loud to yourself a little bit each day. And that can actually train your brain to hear better in background noise. So those are things that we're trying to kind of include in our treatment program, along with just the hearing aids, because we've learned that, hearing aids sometimes are not enough. And just testing your ears is not enough. Hearing is more involved in that. So if you are curious about this functional hearing assessment, we've already been scheduling them. We've been doing them on patients already. That part of the assessment is not covered through insurance, so it's out of pocket for these additional tests. If you want to discuss more about it, you can contact Beth or your doctor, and we can schedule that or talk about it. But I think it's what we need to do now, because there's just so many studies of how hearing is affecting our brain health and cognition, and it's just something that's kind of been overlooked until now. So we're hoping we can help more people this way as well. So that's what this was talking about. So brain hearing technology, having that good technology that feeds your brain all that good information, plus doing that auditory training exercises, we've learned that people really do a lot better. What that means is they understand people better, they hear better in background noise, when these two options are kind of included together. So that's pretty much it. I know this